DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson. I'm glad that you joined me today. We're going to talk about something that everybody can utilize on a day-to-day basis working with your cattle, and that's doing a good physical exam and understanding clinical signs of cattle, when they're doing well, when maybe they have a problem that we need to get them in and check them out a little bit better. Thanks for watching today's show. More after these messages.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, Dr. Dan here. Thanks for joining me today. My name is Dr. Dan Thompson, and I'm the Jones Professor of Production Medicine and Epidemiology here at Kansas State University, where I'm a veterinarian and a PhD in nutrition. And today we're going to talk about looking at the animals in the pen, deciding when the animal has something that we need to approach the animal, bring it in to get a closer look, or do a thorough physical exam, and some things that you can do at your home, on your ranch, your farm, and things that I'll look for out in the pen. And so the first thing we're going to do is we're going to go out to the pen, we're going to feed the cattle, or we're going to put out a supplement, and if cattle don't come up to eat, if we have a change in behavior, that's the first thing that's going to tip me off. Because the old adage is that sick cattle don't eat, and cattle that don't eat get sick. The other thing that we'll look for is kind of the DART method, okay? And DART the acronym DART, D is for depression, A for anorexia, R for respiration, and T for rectal temperature. Now, we aren't going to take the rectal temperature out in the pen unless you're a lot faster than me. And so we're going to look at the first three letters, depression. The first thing about a depressed animal is they'll stand off by themselves. Animals that are sick, they don't want to be part of the group, they'll go and they'll stand, they'll isolate themselves. And a depressed calf will be one that has its head down, its ears down. It'll have a dull, listless look in its eyes, and it won't really pay a whole lot of attention to you until you get within its flight zone. The next part of that is anorexia, meaning the animal's not eating. And so what we want to look for is look at the sides of the animal. Back in the paralumbar fossa, or in that area between the ribs and the hip, that indentation where the rumen normally is a nice rounded side to the calf, but when a calf's off feed, they'll have an indentation and they'll be slab-sided, or gant is the term that we utilize. And when we have cattle that are gant, they could be off feed because of pain to their hoof. It could be, it's very, very sensitive in a calf that's starting to suffer from respiratory disease. And so it's a very sensitive measure of when the animal goes off feed. They'll go off feed 3 or 4 days before we'll see the depression. So anorexia, in my opinion, is very important in being able to identify cattle that maybe aren't doing so well. And then respiration rate, we'll talk more about respiration rate, as cattle generally take 20 to 30 breaths in a minute. And we'll talk more about cattle respiration rate, how they respire, whether it's shallow breathing, deep breaths, and how those can be different on different types of clinical syndromes going on within the bovine. The last thing I'll look at in the pen is I will read the feces. Now, when cattle are stacking feces, they might be dehydrated. And so the feces will stack up when the calf defecates. If the animal has diarrhea, which in neonates we're thinking about neonatal calf diarrhea, or in a feeder steer we're thinking about acidosis or some sort of metabolic issue going on to cause that diarrhea, we'll look out in the home pen, and if we see a lot of diarrhea on the home pen, or if the cattle are painting their butts. When a calf has diarrhea, the feces will get on the tail, they swish their tail, it'll look like a windshield wiper type pattern on their butts. Those are just some of the things. When we come back, we're going to discuss lameness in the home pen, and then we'll take that animal to shoot and talk about doing a physical exam. Thanks for watching DocTalk.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Darcy Messerli has no specific memory of when she decided to pursue veterinary medicine as a career goal. All she knows is that she's always wanted to be one, a desire fostered by her association with animals and livestock production as a child. Blessed with a group of mentors who helped guide her, Darcy plans to join a mixed animal rural practice after graduation.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
The new Better Horses Network is worldwide. Presented by Lucas Oil. Featuring worldwide radio and TV with iconic hosts like Al Dunning, Sharon Camarillo, Ernie Rodina, Lindy Birch, and Craig Cameron. With American Cowboy, Horse and Rider, Brushy Creek, Cavenders, and Ride TV. Worldwide radio and TV. The all-new Better Horses Network.
Do your cattle struggle with pink eye, BRD, or another disease? Contact Newport Laboratories for a customized solution. Our custom-made vaccines are produced using the specific diseases found in your area. These USDA licensed vaccines offer potential cost savings on vaccine and labor. Contact your veterinarian or Newport Laboratories the next time your cattle are in need of a custom solution. Newport Laboratories custom-made vaccine, because every situation is different.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, where I serve as the Jones Professor of Production Medicine, and I'm located in the Department of Diagnostic Medicine and Pathobiology. And I spend a lot of time working with farmers and ranchers and veterinarians on how to identify cattle that are sick or lame. And when we talk about lameness, a lot of times we don't pick up on the subtleties of lameness soon enough. The sooner we can identify a calf becoming lame, we can get them in, we can apply the treatments. Generally, if we get it done sooner, it'll be a lot better outcome, treatment and case outcome, than if we put it off or we don't diagnose it until the animal's non-weight bearing. So, Zenpro Animal Health has come up with a scoring system. And in Zenpro's scoring system for lameness, it's a 0 through 3. And a 0 is an animal that's normal. So the animal is walking, they have a long stride, their stride, the back foot basically lands where the front foot is leaving. So when you look at the normal stride of a bovine, that stride length or that back foot will almost replace where the front foot was as the animal walks forward. The first subtle sign of lameness in a calf is short-strided. So the calf won't reach as far with the back limb, or they're taking shorter strides, and so it's more of a choppy, and that foot is not replacing where the front foot was. So that will be our first sign, and that would be a lameness score of 1. When we move to a lameness score of 2, which is more severe than a 1, then the animal is not only short-strided or having a shorter stride, as you can see from this video clip, but the animal also has the head bob. Now, in a horse that's lame on a front limb, what we'll say is the head goes down with the sound, and same with cattle. So if the calf is walking forward and they have a head bob, when their head goes down, their head is actually going down when they land on the sound foot. So when their head is up during the head bob, that is when they're landing on the limb that's lame. So you can kind of match that up and narrow it down as to which limb you're going to look at. As we move from a severity score 2 to severity score 3, it's 3 being the most severe. These animals are either recumbent and down, or if they're up, they're non-weight bearing at all on that limb. So a 0 is normal, a 1 is short-strided, a 2 is short-strided with the head bob, and again, the animal's head goes down with the sound limb on the front limb lameness, and then a 3 is non-weight bearing. The sooner we bring those cattle to the chute, the better. So when you bring an animal out of a pen, and now we're going to go from the pen to the hospital area, or from the pen to the chute, you want to be looking at how that animal's moving. You want to be looking at the pen conditions as you come out. You want to be looking at the potential for diarrhea, and we're going to look at the gantness of the animal. And all of those are going into your Rolodex as you're bringing that animal to the chute to get a more thorough diagnostic review of that animal through a physical exam. While we take the commercial break, we'll move old Bossy into the chute so that we can do a thorough physical exam.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
I'm Dr. Kip Lukasevich with Production Animal Consultation. Today's BQA Tip of the Day is proper alignment with the trailer and the chute. It's really important that when cattle arrive at a feedlot, or when the cattle are being loaded out for shipping, that trucks, when they come in to back up to the loading facilities, is that when they come in, they're square with the alley in which they come in. Sometimes we have trucks where they're 6 inches off or 12 inches off, and what that creates is it creates an option to bruise cattle, and shoulder bruises, flank bruises, any of those types of things. The other injury that can occur in that instance is if we get a leg that falls off, or if there's too much space between the loading dock and the truck, where a foot can slip through and we can fracture a leg. So the most important tip is make sure that we're square, make sure that we're flush when we come back, and that everything is in line for cattle to properly load into the truck. And that is your tip of the day.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
It takes vision, dedication, hard work. It takes knowing who you can trust. At Zinpro Corporation, we have more industry-endorsed research behind our trace minerals than any other company. Proof that our patented performance minerals help improve overall animal health and performance. Lots of companies make claims. At Zinpro, we generate results.
Do your cattle struggle with pink eye, BRD, or another disease? Contact Newport Laboratories for a customized solution. Our custom-made vaccines are produced using the specific diseases found in your area. These USDA licensed vaccines offer potential cost savings on vaccine and labor. Contact your veterinarian or Newport Laboratories the next time your cattle are in need of a custom solution. Newport Laboratories custom-made vaccine, because every situation is different.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, this is Dr. Dan from DocTalk. We have moved Bossy into the chute. So now we're going to do the physical exam. And the big thing about a physical exam, you want to start out, you want to make sure that you all have the ability to restrain an animal. If you're going to work with the head, use a halter. If you're going to do something with the side of the cow, make sure you have a squeeze chute or a stanchion or a way to put that animal in a place where it's not going to hurt you or kick you or hurt somebody that's working on your farm or ranch. And if you're going to work with the legs, you're going to make sure you have ropes, okay? And so we're going to make sure that we have ropes out there, and we'll talk a little bit about how we can maneuver the animal within a squeeze chute so that we can examine the head, so we can examine the rumen, so we can examine the legs, and different things that we're going to do during the physical exam. But the first thing we're going to do in the physical exam is we're going to take a rectal temperature. Now, the normal rectal temperature of an adult cow is 100.5 to 102.5. And then for a baby calf, we increase that 1 degree. So the normal, for a baby calf or a feeder steer, normal rectal temp is 101.5 to 103.5. Anything above the normal range is indicative of disease process or running a fever. One thing to be cautious of, though, is that when you're taking a rectal temperature in the summer or times when we have high environmental temperatures, the animal, if they aren't dissipating heat and they're accumulating heat load, they can actually have a slight increase in rectal temp, which would be normal. But when we get in that 105, 106, 107, we definitely have some sort of infection, whether it's a virus or a bacteria, that's going on in this animal, some undifferentiated fever or cause of fever, and we need to, which warrants a greater physical exam of that animal. Now, when you take rectal temperature, one thing you want to make sure of is that you have a calibrated or thermometer, and make sure your thermometer is working properly. The other one is that you'd be amazed that when we don't lift the tail to insert the thermometer, if you're having to just try to angle that thermometer into the rectum, you can actually perforate the rectum with your thermometer, and we've seen that in some cases. So make sure that you lift the tail. If you want to use lube on the thermometer, but make sure you lift the tail and that you do a proper insertion of that thermometer. Make sure you have the thermometer against the rectum wall so that you get an accurate reading and not in the lumen. But 101.5 to 103.5 for our feeder steers. For a cow that you bring in out of the pasture, 100.5 to 102.5. If I'm moving up to the head, the one thing I might look at is first I want to determine how old this cow is. And if you don't know how to age a cow, we can do so based on the incisors. And once the first two incisors, the calves are born with baby teeth. And the baby teeth fall out at different ages along the cow's life. And at 18 to 24 months is when you'll have the first two incisors of permanent teeth. From 24 to 30 months, you'll have 2 sets of incisors. At 3 years of age or 36 months, you'll have 3 sets of incisors. And then 42 to 48 months or a 4-year-old cow will have 4 sets of incisors. And that's how you can start to score them. But one of the most important things, if you have a cow that's skinny that you're bringing in, look in her mouth to make sure she has teeth. Smooth-mouthed cows have trouble grazing and might not be able to keep up. We're going to take another break, and when we come back, we'll continue on our physical exam and walk you through. Thanks for watching DocTalk. More after these messages.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica Inc.
Howdy, I'm Kurt Pate with the Tip of the Day. We deal with a lot of bulls around this place, and we get along with them pretty good because we work them a lot. And if you work them properly and move them quite a bit, the fighting will reduce, and every time you move them, they learn to take pressure, and then when you start to work with them, they don't start fighting each other.
I've always had an interest in care for the animals and their well-being. Really what we want to do is work hard to eliminate as much feedlot lameness or beef cattle lameness as possible.
How we feed a cow on a daily basis can not only have daily effects, but they can also have long-term effects on claw health, reproductive performance, mammary health, all of those factors, as we look at the inputs and the response that the animal has to what we feed them.
when animals have adequate intake of effective nutrients, we take care of the immune system and performance follows. It's important that the consumers understand our dedication to the well-being of these animals.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Horn flies are a nuisance and a production loss, so getting rid of the problem is important. What I like about the vet gun is you don't have to go out there weekly to treat them with a topical fly applicant. It has some duration, it lasts. You see the increase in weight gain, it just works. I've used it on our 1,500 cow-calf operation, and it makes me more confident in saying, hey, this product's gonna work on your operation too.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
It's easy to spot the man who uses Synanthic. With lower volume and less waste, Synanthic steps up your deworming routine. Get more deworming with less dewormer at Synanthic.com.
Beringer Ingelheim Vetmedica Inc. knows the importance of beef quality assurance and asks you to step up and get certified. Go to bqa.org for details.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
All right, folks, let's continue on our physical exam, and we're going to look at the eyes. And the eyes can tell a story. If they're dull and listless, that means an animal could be depressed. If the eyes are sunken in, that's pretty indicative of dehydration. If the eyes are bulging in an older cow, it could mean that we have bovine leukosis virus and we have some sort of lymphoma or something going on in that cow that we need to make sure that we're getting her taken care of. Also on the dehydration front, to determine dehydration, we'll first look and see if the eyes are sunken. The other one is a skin tint. And if I pull that loose area of the skin and it doesn't go back right away in the normal place, that means that animal is dehydrated. So it'll stay in that tinted form longer than normal. Okay, I'll also look at the nose. If the nose has got feed on it, I probably pulled a calf that looked ugly and not one that was sick. Feed on the nose is a good thing. But if the nose is dried, cracked, red, generally means that animal has something going on in a disease process, running a fever or such. Other things that I'm going to look at. I'm going to look at normal heartbeats. A lot of times people don't even know. The normal number of heartbeats are 40 to 70 beats per minute in a cow. Respiration rate, normal respiration rate in a cow is 10 to 30 breaths per minute. And the last thing I want to look at is a normal functioning rumen. The cow or steer should have 1 to 2 rumen contractions per minute. If they aren't, there's a high potential of bloat. There could be something going on that's causing rumen stasis and decrease in digestion within that rumen. When you want to take the heart rate or you want to take the respiration rate or measure rumen motility, you can use a stethoscope. A cheap stethoscope is worth a lot when it comes to a physical exam. Place the stethoscope on the cardiac region to listen to heartbeats. You can actually listen to the lungs, inspire air and move air and count the number of breaths. But using that stethoscope back in that paralumbar fossa, in that area between the hips and the ribs, you'll actually hear a roar or a roll of the rumen contractions. If you don't have a stethoscope, you can take the pulse of a cow underneath the jaw, or you can watch respiration rates, or you can manually, physically put your fist in that paralumbar fossa area and feel the rumen contractions as they move over your fist. Many different tricks to physical exams. I really appreciate y'all watching DocTalk. Be sure you work with your local veterinarian, and if you want to know more about what we do at DocTalk, you can find us on the web at www.doctalktv.com. Thanks for watching today. I'm Dr. Dan Thompson, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.